the structural and strategic side. So Salvador Minuchin talks about the structure of the family. He defines a hierarchy, and that's really important. To the structure and to Salvador Minuchin is the proper hierarchy in the family. So when you see his diagrams, you'll see the two levels. At the top level, the executive level, the parent level, the lower level is the child hold on, or the child level. And that's an appropriate hierarchy. With pathology is that hierarchy gets messed up, and one of the most common ones is called an inverted hierarchy, where the parent goes to the role of the child and the child goes to the role of the parent, to where the child is judging the parent as if the parent were a child, and as if the child were a parent, and that's called a role reversal, and it's an inverted hierarchy. Now that happens primarily for two different reasons. One is the parent abdicates power. And I see a lot of that times over in juvenile justice, where I got an inverted hierarchy because the parent's not being a parent. And so I need to and get the parent back up in the parent role and the child back down in the child role. And so the parent abdicates is one way you get that. The other way you get that is a cross-generational coalition with one parent against the other parent. And so then that parent-child alliance then gets the inverted hierarchy, because the child is being empowered by the alliance. So I once heard Salvador Minuchin talk and do some training videos and stuff. And one of the things he said that was really interesting, he said, adults are always more powerful than a child. And so a child cannot be as powerful as an adult unless the child's standing on someone's shoulders. Yeah, that's well put. And so the child is being empowered from somewhere. And that's the cross-generational coalition. Now, when I get over here, knowing family system therapy, inverted hierarchy, and I look, and the child is actually being empowered to defy court orders. Holy cow, they're above a judge. They're telling the judge what the judge's court order should be over here. If you order me to go with my other parent, I'm going to run away from home. Well, we can't order the judge. The child's above the judge. Holy cow! Not all the time. Now, some of the judges are good, but I'm seeing even the idea that the child is defying a court order. Are you serious? No. With the court orders are court orders. All adults need to know how to follow them. Certainly, all kids. So the court should not be worried about whether or not the child follows their court order. If they have a problem, if the child has a problem, that's a treatment issue, and it's likely a treatment issue with the allied parent not teaching your child proper values. Oh, what about abuse from the targeted parent? That's okay. We'll assess for that. We'll see if there's abuse there. But if that's a normal range parent, then we need to be looking at different directions on that. So that's the structural and the hierarchy kind of thing from Salvador Minuchin. Now I want to show you a picture on page 42, I think it is. Yeah, it's 42 of Salvador Minuchin's book with Mike Nichols, Family Healing here. And this is the diagram that I put on all my slides and stuff. So when I post things and you see that diagram of the family, I say, this is where it is. I'll show you exactly where on page 42 it is on this. And so you see that there? And so you see right here, the father and the son are in this coalition. And you can see the inverted. The mother is in the child role, and the son is above her, judging down. And you see those three little lines there. Those are the enmeshed relationship. That's a boundary violation. And so you see the three little lines there. And then, oh, look, you see that cutoff? Yeah. Between the father and the mother, and then between the son and the mother. And those little broken lines. That's the emotional cutoff. And oh my goodness. This diagram is exactly the pathology there that's in this court-involved family conflict. And the idea that all these forensic psychologists the entire time have not told a single judge what the pathology is. The inverted hierarchy. In fact, they were actually like telling parents you need to apologize for a delusion. They're supporting the inverted hierarchy. Oh my goodness, they don't even see it. And so that's a problem. That's really a problem. If you're doing an evaluation of the family for anything, My goodness gracious, learn family systems, please, so that you have some idea about what you're doing. The other group, the other school, strategic, is the one. It's just marvelous. I work mostly from this, but I keep this in the background if I can come up with something. It's a nice one. And what strategic family systems therapy says is the child's symptoms confer power. And that's an interesting, and you think about it, yeah, they do. So you think about somebody who's anxious, everybody has to make accommodations for their anxiety. I can't do that. I can't do that. The symptom confers power. Okay. The most powerful person in the family is the one with the symptom. Remember that. The most powerful person in the family is the one with the symptom. So you look at the child's symptom, rejecting the targeted parent, and you say, where's the power in that? How is that conferring power in this family? Well, it's giving the allied parent the power to nullify any court orders for visitation because now the child is rejecting the other, and so the court is reluctant to override the child, and so it's giving power to the allied parent to override the court's decision on child custody, and it's giving power to the allied parent to inflict emotional grief and loss and suffering on the other spouse in retaliation and revenge for the failed marriage and divorce. So that's the power that the child's symptom is conferring. So we will not be able to alter the child's symptoms until we alter the power that the symptom is conferring within the family. So within that, because I know strategic, I know structural, I know all, I just don't. So as long as I'm here, I figured I would give you a strategic family systems intervention to solve things. And what strategic family systems is so interesting about is that once you identify how the power is moving in the family, we then develop what's called a prescriptive intervention. We say, do this thing, and we tell them exactly what to do. And if they do that, it will change the power dynamic. Know why, it just will. It will change how power's moving in the family, and the symptom will go away because the function it serves in the family will go away. And the client doesn't even have to know why or how it works. They just have to do what we tell them to do, and it'll just go away. And so, but the difficulty with that is, first, as a psychologist, you have to understand the family at the level that allows you to see the power dynamic move. And then once you see that, there's a creativity to coming up with that prescriptive intervention. That's how power is moving. What can I do to alter that power? And then you tell them to do something, and it's going to and they don't even need to know why. You can tell them why if you want. And even if they resist, there's like things, because that's a power dynamic. They're resisting, so you just and it winds up changing. And so it's a really interesting and powerful approach. It takes skill to do. And so since I'm over here, I gave you one, which is the contingent visitation schedule. So I developed a strategic intervention for this family conflict because the child's power is going this way. And I wrote a little 50-page manual on this contingent visitation schedule. And there's two areas where it can be effective. If you don't want to go into protective separation and you're trying to avoid it, is there anything you can do? No, because child abuse diagnosis and treatment, good diagnosis guides treatment. So the treatment for child abuse is a protective separation. So no, there's nothing you can do. If you want to do something, it would be, Dr. Childress, is there anything we could do? Potentially a strategic family systems that changes the power dynamic and puts a symptom monitoring on the child's symptoms of psychological abuse, so we know the child's safe, potentially. So I came up with that. And what it does essentially is it takes the baseline court orders for whatever the custody schedule is, and that's normal. So as long as the child, based on your outcome measure, the parent-child relationship rating scale, as long as the child's normal range on that, then that's the custody. If the child goes symptomatic, then we reduce time with the allied parent and increase it with the targeted parent. So it's reversing the power dynamic. If the child goes symptomatic, the targeted parent gets more time. And then if the child's normal, then the allied parent. And so now we've reversed how the symptom the child's acting out is conferring power, and we'll stop. Um, and we're putting a symptom monitoring onto the child to make sure there's no symptoms of child abuse. And that's important to do. I really encourage all psychology people, all parents, please, please, please put an outcome measure on your treatments and your, please. A symptom ratings measures of some kind. I recommend parent-child relationship rating scale. You can just grab it. It's free. Yay. But we need to be monitoring the child's symptoms of child abuse. And in physical child abuse, so symptoms are bruises and cuts and things, that physical. In psychological child abuse, the symptoms are the behavioral and emotional acting out. So we need to be monitoring that on some sort of outcome measure rating so that we know if those go up, the child's being psychologically abused. We want those in the normal range. And so please, please, please start putting on outcome measures. It is considered standard of practice everywhere else, but here, please. Um, the, so the contingent visitation schedule is useful if you're trying to avoid something potentially. Maybe an agreement. So rather than a court order, you're going to agree to that. And what it is, it's not a change to the visitation schedule, the custody schedule, because that's whatever the court orders. But if the child's symptoms go up, then it's it's a treatment response that alters the visitation schedule in a very structured and defined way based on the child's symptoms. And then when the child's symptoms come down, this goes back to the custody schedule. So it's a treatment intervention rather, and so the court could order this is it. Preferably, the parents could just say, "We'll do this," and it's very defined, and you put a family monitor the rules of the contingent visitation schedule. It looks kind of like a behavioral program, but it's not as strategic. That's moving power around. Um, the other place that it would be useful for is at the reunification with the reestablishing contact with the pathogenic abusive allied parent. So after the protective separation, we've recovered the child, restored their normal range of development. We're now reintroducing the formerly abusive parent to the child, and we're worried that this parent's going to start psychologically abusing the child again. The symptoms are the behavioral and emotional symptoms, so we're monitoring that through the recovery and into the restoration phase. And then we put the contingent visitation schedule on as another protective safeguard. So their custody would, let's say, 50-50. As the protective separation is over, we go back to 50-50 custody, and great, but we have the monitor rating, and if the child becomes symptomatic again, then is a structured way of reducing that parent's time and increasing the other parent's time based on the child's symptoms. And when the child goes back again, we come back to 50-50 again. And so that would be the area. It would be like adding a supervised visitation to a physically abusive parent or an alcoholic. So we're monitoring that type of child abuse. For psychological child abuse, it's putting a protective supervision on the child abuse, because if the child becomes symptomatic, we're going to reduce the time with that parent. The other thing that it provides the child with is an excuse to bond to the targeted parent without exposing them to retaliation from the allied parent. So the child has to show appropriate and normal range behavior, not sixes and sevens, and just threes and fours, just five, just normal kind of. And if the child stays normal, yay! That's what we're encouraging the child to do, and just don't get symptomatic. And so now that gives a child a face-saving way to bond to the parent without exposing them into the alliance and their loyalty alliance to the allied parent. And so the contingent visitation schedule solves a number of issues.